My name's Katelyn. I work in the CAD/CAM department and I am our logistics coordinator. So an implant is typically what gets placed in a patient's mouth, like if a tooth fails and they have to get a whole tooth removed. So you'll get referred to a surgeon, and a surgeon will place the implant itself into your jaw. And what we make is the abutment, which will then set the crown on top and hold. It will screw into the implant that is placed in the patient's jaw. Most of the time we're doing titanium because of strength, especially on like a posterior tooth, so anything further in the back. That's where a lot of like the power of your bite is. So a zirconia abutment is going to be a little more fragile, and where titanium is going to hold up, it's going to be a lot stronger. So we have custom abutments that we can mill in-house. So we do have what we consider a tie base. It's a titanium little cylinder base. They're pre-milled, and then we just design a crown around that base. So a patient would normally require an implant if a tooth has failed and they don't have anything in that tooth position anymore. For a normal tooth, like a crown or a bridge restoration that we do, what that crown is sitting on top of is your natural tooth that is ground down. So they call that a prepped tooth. So the crown will sit on the prepped tooth. So for an implant, there is nothing there to start except the implant that is placed in the patient's jaw. So we are creating pretty much that prep from the abutment and the crown that will seat on top. So we have a screw-retained option, which is more popular as we're going on in the industry. So normally our screw-retained restorations, when they go to the doctor, the crown and the abutment are cemented together in our lab. So it is one piece that the doctor has to deal with. So they screw that restoration in and fill the access hole. There are, like I said, some instances where screw-retained isn't a great option. So in that instance, we do a cement retained, where you have the abutment and the crown separate from the lab. We put the abutment in the patient's mouth. Once that's fully seated, then the doctor will put cement on the inside of the crown and seat it down onto the abutment. A doctor would usually prefer cement retained, say like if you're getting your number 8 done, which is on your two front teeth. If the access hole is going to be smack dab in the middle of the front of your tooth, there is a low chance that the doctor is going to be able to patch that access hole, where the doctor would screw that in and make it look like a natural tooth. So if we do cement retained, there's no hole that the doctor has to worry about, and it looks just like a normal crown restoration that we would have sent out. So say they need an implant right here, but there's more bone structure a little further back, they're going to angle that abutment towards that bone. So we would have to make a custom abutment to customize angle and thickness of the abutment. So it kind of just depends case by case, but we have a lot of different options that we can service.
Visit vitalitydentalarts.com.